everyone. My name is Janki Patel. I'm a nurse practitioner student at Cedar Crest College. I'm going to be doing my presentation on the critical appraisal of critical technology. And the technology I chose to do this presentation on is the Swan-Ganz catheter, also known as the pulmonary artery catheter. The clinical site I'm going to be discussing is Lehigh Valley Health Network. Lehigh Valley Health Network is where I work. I've been part of this network for about 2 years now. LVHN's mission statement is, we heal, comfort, and care for the people of our community by providing advanced and compassionate health care of superior quality and value supported by education and clinical research. Lehigh Valley's motto is a passion for better medicine. LVHN is a huge network and it consists of 8 campuses. There is Lehigh Valley Cedar Crest, 17th Street, Tillman, Muhlenberg, Hazleton, Pocono, Schuylkill East, and Schuylkill South. LVHN has the only children's hospital in the Lehigh Valley. That includes the Children's ER, inpatient and outpatient care, Children's Surgery Center, more than 25 pediatric specialties, and many child-specific services. Within the community, there are numerous health centers that offers doctor's visits, laboratory, and imaging services. There are also many express care locations where patients can just walk in without appointments, and this also includes the Children's Express Care. There are more than 1,340 primary care and specialty physicians part of this network, and about 17,000 employees that are employed at LVHN. Lehigh Valley Heart Institute. I'm very proud of this because I work in the cardiac ICU. It's incredible to know that more than twice as many heart patients choose LVHN than any other hospital in the region. LVHN utilizes advanced technology and groundbreaking research to take on challenges most hospitals turn away. Recently, on 69 News, I found an article that discussed how Lehigh Valley Heart Institute is the first in the region selected to participate in the National Cardiogenic Shock Initiative to develop best practices and improve survival of heart attack patients with cardiogenic shock. This is huge. Not only does Lehigh Valley participate in research studies in the valley, but they are now expanding to nationals. For this presentation, I interviewed 3 staff members. Jennifer Nessifer, she's a second-year cardiac fellow. Jeffrey Martin, who's been a nurse for about 25 years. And Stacy Davis, who's an RN, CCRN, and MSN. And she's our patient care specialist. The reason why I chose to interview Jeffrey Martin, because he's a user of this clinical technology. He's also takes the role of a charge nurse. He provides care to patients that have pulmonary artery catheters, and he also assists physicians in the placement when physicians place the catheter at bedside. Stacy Davis, like I said, she's our patient care specialist. She's also a user of this clinical technology. She's our educator. She tracks the rate of infections associated with central lines, and she provides education on quality and safety improvements. Jennifer Nessifer is the last person I interviewed. She's a physician that places the pulmonary artery catheter either at bedside or in the cardiac cath lab. She obtains consent prior to the placement. She decides on the benefits versus the risk, determines the appropriate placement. She looks at the chest x-ray to determine if the placement is proper. She evaluates when the catheter can be DC'd. The Swan-Ganz pulmonary artery catheter is used to obtain a clear, comprehensive hemodynamic profile of a patient by a single catheter. It helps clinicians assess the cardiovascular function and guide treatment decisions. It measures cardiac output, mixed venous oximetry, right ventricular ejection fraction, and right ventricular end diastolic volume. It allows continuous monitoring of the balance of oxygen delivery and consumption. SvO2 is one of the earliest indicators of a threat to tissue oxygenation, and by continuously monitoring it, it alerts clinicians to a change in patient's condition sooner than other methods. How this pulmonary catheter works is that it gets transduced, and we're able to monitor the pressure waveform on the monitor. And we can easily get a mixed venous blood gas, which shows the mixed venous oximetry, and this is helpful when patients are on inotropes, where we have to determine the correct therapeutic level that the patient needs. The most frequent indication for PACs are suspicion or presence of pulmonary artery hypertension, cardiogenic shock, assessment of the volume status in severe shock, evaluation of suspected cardiac tamponade, assessment of right-sided valvular disease, congenital heart disease, and cardiac shunts. In practice, I've seen pulmonary artery catheters being used for volume status, to determine if the patient is fluid overloaded and if we're properly diuresing the patient. I've seen it used in pulmonary hypertension and cardiogenic shock, like I mentioned, when the patients are on inotropes. So what the pulmonary artery catheter looks like is have images right here on the right. So it can either be a 4-lumen or a 5-lumen. The difference between the 4-lumen and the 5-lumen is just like an extra port that the 5-lumen has that nurses can use for any infusions. And this is very helpful when the patient in the ICU have many drips going and they're not compatible with one another. So the blue lumen is the CVP. It goes into the right atrium and it measures the right atrial pressure. The white or the clear lumen is the extra port I was talking about, just for infusions. The yellow lumen is the pulmonary artery catheter, and this measures the pulmonary artery pressure, and it's used to obtain the mixed venous gas. The port that has the red and the white connector is the temperature sensitive wire, and this allows us to determine the cardiac output when we are doing thermodilution. The red port with the syringe attached to it is the balloon that is used to obtain the wedge pressure in the main pulmonary artery. Air is used to inflate the balloon, and when you remove all the air out, the balloon is deflated. So pulmonary artery catheter placement. So this is an invasive procedure in which intravascular catheter is inserted through a central vein. Central vein can be internal, jugular, femoral, or subclavian. So that is connected to the right heart and it gets towards the pulmonary vein. So let's talk about the anatomy of the heart. So when the catheter is inserted from the central vein, it goes into the superior or the inferior vena cava, and then to the right atrium. From the right atrium, it goes through the tricuspid valve. The catheter reaches the right ventricle. At this point, the balloon can be inflated, and this helps the catheter to move the right ventricular outflow tract and there through the pulmonary artery after getting across the pulmonary valve. The tip of the catheter lays into the main pulmonary artery where the balloon can be inflated and deflated for the measurement of the pressure. And when we use the syringe to inflate the balloon, we're actually getting the wedge pressure. So the pros and cons of the Swan-Ganz catheter. The pros, it helps determine the cause of shock. It helps determine if it's cardiogenic, septic, or distributive shock. It determines the cause of pulmonary hypertension, and we can properly treat that. Determine the intracardiac pressure and with this valvular abnormalities. Most importantly, it helps diagnose and helps management of different conditions. One of the pros, the nurses that I interviewed mentioned that it's easy to use. This is also pertains to like cardiac ICU nurses. They have to be properly trained and educated on how to use this. The cons of the Swan-Ganz catheter is that infection can occur at the insertion site, pneumothorax or hemothorax after insertion. So it's important to obtain a chest x-ray after the placement of a swan. Another con is air embolism. Atrial ventricular arrhythmias can occur. Valvular rupture or cardiac wall perforation. Misplacement of the catheter, it can loop into the right, any part of the right chambers. Vessel rupture can happen at the moment the balloon is inflated into the pulmonary artery. Patients have to be on bed rest. Bleeding can occur at the insertion site, especially if a patient's anticoagulated. One thing I did want to note was the rupture that can happen when the balloon is inflated into pulmonary artery. Research studies have shown that with this, mortality rate is 50 to 60%. So related healthcare information technologies. Other similar devices like the Swan-Ganz is the Cheetah Medical Starling hemodynamic monitoring system. This is 100% non-invasive assessment of fluid responsiveness to guide volume management. It measures the stroke volume index, cardiac index, and total peripheral resistance index, which can measure vascular tone. And another method that's similar to what a PAC can do is the Fick principle. It measures the cardiac output. Cardiac output is calculated by using the formula, which is oxygen consumption divided by arteriovenous oxygen gradient. But the true with the pulmonary artery catheter, it sits in the pulmonary vein, so that's a true mixed venous blood gas, which none of these can truly obtain. The administration is committed to providing resources to support this technology. IT is there for when the pressures are not being transferred into the electronic health record. Sometimes nurses have trouble transferring the pressures going into Epic, and we call IT and they're able to assist us with that. Recommendations continue with the use of Swan-Ganz for most severe patients in complex clinical situations. The Swan-Ganz catheter allows calculation of important metabolic variables like oxygen delivery, consumption, and extraction. It's helpful to diagnose right ventricular failure that is shown by increased arterial pressure and decreased pulmonary artery pressure. The Swan-Ganz catheter must be preserved and taught properly to remain a key tool for bedside hemodynamic monitoring. So that's my presentation, and I have the references listed here. Thank you.